السلام عليكم أعزائي الطلاب، أتمنى لكم الموفقية والصحة والسلامة دوم. إن شاء الله اليوم راح نتكلم عن الجزء الخامس للإنفكشيوس ديزيز. Let's begin with Ankylostoma jejunale. There are three species of hookworm that cause human infection. First of all is Ancylostoma jejunale, which is most common in Mediterranean countries, and Necator americanus in North and South America, and Ancylostoma cyninicum, which is most common in India, Southeast Asia. The hookworm life cycle begins with passage of eggs from an adult host into the stool. Hookworm eggs hatch in the soil to release larvae that mature into infective larvae. Infection is usually transmitted by larval penetration into human skin and may also be transmitted by the oral route. From the skin, larvae migrate into the blood vessels and are carried to the lungs, where they penetrate into the pulmonary alveoli, ascend the bronchial tree to the pharynx, and are swallowed. Clinical manifestations include dermal penetration by infective larvae, transpulmonary passage, acute gastrointestinal symptoms, and chronic nutritional impairment. Hookworms cause blood loss during attachment to the intestinal mucosa by lacerating capillaries and ingesting extravasated blood. The daily losses of blood, iron, and albumin can lead to anemia and contribute to impaired nutrition, especially in patients with heavy infection. The diagnosis is established by stool examination by a microscopy or PCR for eggs. There are no reliable serological tests available. We suggest albendazole for treatment of hookworm infection and mebendazole, parenteral palmoids are acceptable but less effective alternative therapies. Don't forget, for iron replacement alone can lead to restoration of a normal hemoglobin level in individuals with hookworm infection, but anemia recurs unless antihelminthic therapy is given. Ascaris lumbricoides, or roundworm, is worldwide infection in wet climate. In addition, the prevalence is high in areas where suboptimal sanitation practices lead to increased contamination of soil, water, and food. The life cycle of Ascariasis is, after all ingestion of eggs via contaminated food or water, the eggs hatch in the small intestine and release larvae that migrate hematogenously to the lungs. In the alveoli, the larvae mature over periods of approximately 10 days, then ascend the bronchial tree and are swallowed. Once back in the intestine, they mature into adult worms that inhabit the lumen of the small intestine, usually in the jejunum or ileum. When both female and male worms are present in the intestine, female worms produce fertilized eggs that pass into the stool. The eggs prefer warm, shady, moist conditions under which they can survive for up to 10 years. Most patients with ascariasis are asymptomatic. When symptoms do occur, they occur most often during the late phase adult worm intestinal stage, but may also occur during the early phase larval migration stage, in which there is maybe transient respiratory symptoms and eosinophilic pneumonitis, or non-specific symptoms which are abdominal discomforts, anorexia, nausea, vomiting, and diarrhea. Complications of ascariasis may include obstruction of the intestine, biliary, and/or pancreatic ducts. Treatment also by albendazole, mebendazole, or pyrantyl palmate.